Hello, and welcome to a new edition of Education is the Best Medicine, and thanks for watching. Remember, community public access is your best bet. Please watch it whenever you can. And I just kind of want to start off the show with a thank you to everyone that's been supportive of Education is the Best Medicine and my career as a PA. I appreciate you. Couldn't have done it without you. There are really strange times afoot. So, I was just looking at some information, and I'll bring you more word on it, that now certain areas of medicines aren't considered professional degrees and will not be available for funding. This is from the big, ugly bill. So this is, again, when people decide that what you're doing isn't as important as it's been to as a career, as a practice, and that's kind of sad. It's kind of sad what's going on in the country. Again, I want to thank Marjorie Taylor Greene for her work in moving this bill to have the Epstein files released. And I think this is important because we're talking about the tenure and the tone of the country now and what it means to be American. And so if you're protecting rich, powerful men, you're fine. But if you're trying to go to nursing school or PA school and you need some funding to get you to school, that's not important. The healthcare of America is important. Don't you understand that in this society? And this particular administration does not care about health. It cares about the dispensing of health. It cares about the money of health, but it doesn't care about people's health care, nor the people that work in it. It's quite clear. So if you're wondering why all these things are coming on and around this particular administration, it's the behavior and it is their policy. Simple as that. So want to talk a little bit today about kind of a mix of things. Of course, I try to do that, but it's November, and I want to take up. I want to always keep my health focus along with the political focus, and we'll switch back and forth to that. But I just asked about the 5 major health concerns commonly highlighted in November. And of course, diabetes. Diabetes, type 1 and type 2. Type 1 is when a person is born with the inability to process or have enough insulin or to process insulin so they can have enough to maintain, convert food and sugar for energy. Simple as that. And so when you don't have enough insulin or you're insulin resistant, you don't have that ability, and thereby your body used to use other sources to create energy, protein, muscle, commonly. So the focus is on detection and prevention this month and management, particularly addressing rising rates among communities of color, older adults, individuals with obesity, and efforts to highlight lifestyle changes, regular testing of the A1C, monitoring, improve access to care, can reduce serious complications such as neuropathy, kidney disease, and cardiovascular events. There are also increasingly there's an attention on social determinants like diet and access and cultural factors in regards to economic barriers and to treatment. Economic barriers to treatment. Hey, if you don't have providers to take care of these things, then how do you get them done? So that means that when you cut Medicare, you don't want people to be served, and then you cut the providers that take care of them. You don't want providers to serve them, and then you say, well, they need to take care of themselves. So, for example, the GLP-1 drugs in California as of January 26th will not be covered anymore. These are the Wegovys and the all those drugs that help with weight loss. So this started why President Biden was so important. He was trying to get all these GLP drugs on Medicare before he left office. Of course, when this administration rolled in, it refuse to cover them. Thereby, in California's CalAIM program, California can't cover them because it would eclipse the medical budget if you gave everyone those drugs just for weight loss. And now you get them for other things like diabetes, PCOS, insulin resistance, cardiovascular issues. They're even suggesting even if you have a normal A1C and blood pressure, these drugs still would be a benefit from a cardiovascular standpoint. Again, my thing is to have a discussion with the GLP-1s about the vision problems and just overall side effect profiles, because these folks within 2 years stop these drugs and they're very expensive. So some of it I understand and some of it I don't understand. And I just think there's an attack on poor people. There's an attack on people that cannot, that don't have the ability to pay for these things, because the discussion, if you can't pay for them, you shouldn't have them. I don't think that's true, but that's what they're saying. So diabetes is the number one killer, disabler. And I think what I want people to draw the connection with is that the three major health conditions that I tend to address in a chronic care internal medicine visit are hypertension, diabetes, hyperlipidemia or elevated lipids, and usually a mental health concern, either depression or anxiety. Those are my big 4 or 5 things I always see on an individual and have to assess. So the thing about those 3 conditions is that they're usually asymptomatic for the first 5-10 years of the condition. But an example, hypertension is a silent issue, silent killer, heart attack, stroke, sudden death. And you don't feel these things. You don't feel these things coming on. So I want people to get out of the concept that you will know, or there are symptoms that present in particular with hypertension, diabetes, and elevated lipids. No, not until later in the disease do these things occur. Not until you're having conditions that hospitalize you, heart attack, stroke, kidney failure, peripheral vascular disease, that leads to amputations, for men it's erectile dysfunction. So it's a number of things that happen in these conditions that take people literally by surprise. But no, it takes about 10 years. And so that's why we're into the pre-hypertension, pre-diabetes, because we were waiting so long until the person developed the illnesses and the problems that come along with poorly controlled hypertension, diabetes, elevated lipids, that now it's a signal. And what happens when you become better at doing things, you treat people earlier, and hopefully it limits hospitalization and mortality, death, morbidity, illness from that particular condition. That's the hope. So the hope is moving a system that's preventative and proactive instead of reactive. And what we're going to now means that we're going to be reactive. Well, that's unless you have money, then it will be what you want to pay for. So I think that we are in a really, really interesting time. Again, November diabetes month, get tested, A1C. You should be doing things before you're coming into the provider and saying, the provider saying to you, well, your A1C should be 5.7, but it's over 6. It makes you pre-diabetic, and you need to either start with, guess what? Total lifestyle changes, reduction in weight, no smoking, reduction in alcohol use or no alcohol use, because that's added sugar. So behavioral changes are the toughest changes to make in medicine. And if you're not willing to make those changes, then you're not going to be successful. It's like someone telling you that after a certain amount of time, well, you're childish or you don't listen, or why would you want to be with somebody like that? What would be the issue? What's the issue with not lifting people up and being trying to attempt to be positive, having discussions in an intelligent manner? But that's not the case anymore. That's not what's happening. And that's sad. A second big condition in November is lung cancer and smoking related diseases. In November is Lung Cancer Awareness Month and reinforcing the dangers of smoking and the importance of early screening. Well, tobacco and alcohol are still the number one killers of Americans. You can throw crack, you can throw heroin, you can throw psychedelics, you can throw cannabis, you can throw all of them together, and they don't equal the numbers of people dying or having mortality, death, morbidity, sickness from smoking. It's the number one cause of lung cancer and lung cancer in women. We're seeing more women with lung cancer now. Lung cancer is diagnosed late because this discussion is if you smoking between, if you have 15 pack years, which is like I counted, if you had a half a pack or 10, it's still a pack. And if you're consistently smoking, when you come into my office today, you're still a smoker. From the time you start to the time you know. Well, I took some breaks and I didn't smoke. I mean, I only smoke a half a pack and it's only 6 cigarettes. Well, okay. Well, why are you coughing? Why are you wheezing? Why is this strange looking 2 mm mass on your chest x-ray? And why are you losing weight? I don't know. Okay, good. So, lung cancer is an easy fix. It's an easy preventative fix. Never start smoking. It's the number one risk factor. And not only lung cancer, but nose, ear, nose, and throat cancers, esophageal cancer. It's one of the risk factors. There's no disease that doesn't benefit. There's no disease that benefits from smoking aside of one inflammatory bowel disease. It's I believe it's ulcerative colitis. I have to check that, but I believe it's ulcerative colitis that smoke people that it benefits people that smoking. And now I don't know why, because it's going to mess up everything else. But that's one of the few problems that is benefit by smoking. It's helped by smoking. Excuse me. I don't know if that's a help either. Again, silent disease. I guess what I'm bringing up is that people think that there is a time clock that goes off in their bodies and tells them, oh, you got cancer. Oh, you need to get to the doctor because your blood sugar is high, your blood pressure is high. It doesn't do that. It's usually a ride to the emergency room. It's usually passing out somewhere where EMS is involved and they have to take the person to the hospital. So it's not that clean little, neat thing that you think is going to happen, because it usually turns out ugly. It says that lung cancer remains the leading cause of cancer deaths, often discovered late due to subtle symptoms. Screening with low-dose CT scan or spiral CT scan, and for high-risk adults is a major public health push this month. So that means you go in. I've been smoking at least 15 years. Okay, let's get you a spiral CT scan. They do the scan, and then you become in the surveillance program. It's just like colon cancer now. Colon cancer, once you have polyps, you need to be involved and ensure you're involved in the surveillance program. If the polyps are precancerous and a little bit more virulent, then you almost definitely have to be surveilled. What we were finding, what we were picking up was that, we started doing colonoscopies and picking up all these colon polyps and removing them, and we thought everything was done. Well, 3 to 4 years later, the person came back, and not only did they have cancer had metastasized and gone places where it shouldn't have went. So, it's an ongoing piece. Surveillance is involved in a lot of these conditions: hypertension, diabetes, cancer, obesity, surveillance, monitoring, screening, prevention. The conversation also includes environmental toxins, which is a new thing on the list. How are non-smokers developing cancer? Well, living with a person that smokes, but also environmental toxins. It will be interesting to see the number of folks once they take the freeways out of the center of neighborhoods like West Oakland. What would it mean for them? Because if, and I just, sometimes just like the light comes on. I'm driving toward the exit of West Oakland, and I realize that all these fumes from the car that I'm driving, the car that we drive, is hovering over the neighborhoods. It can't help but it. So what's the answer to that? Electric cars, minimizing driving, that kind of thing. If you can, I commute to work, so I have to. If you can. But the bottom line is that it's not only just people smoking, it's the environment that they're living in. So instead of us trying to move to electrical cars, cut all those subsidies so we can continue to use gas burning cars so that we can fund the Saudi Arabia's oil empire and make deals with an individual that may have murdered a journalist just because he didn't agree with the views. It's amazing that we would want to have an association with someone like that. But welcome to America in 2025. And what I tell people all the time, that 75% of us voted for this individual. 75% of Americans voted for him across all stripes. High Latino, high African American men, high white females, high women of color. The same people that are being ripped off the streets probably voted for him. Because, like anything else, you don't think it's going to happen to you. What I don't understand is why there hasn't been a real connection between these communities, or the discussion should be, how can we work together? But a number of the communities in their community, they're considered white. So if you consider yourself white, then that's not going to happen to you. That's going to happen to somebody else that's not white. Interesting, huh? Well, we'll see how that works out. The third leading issue in November is Alzheimer's disease and dementia. Alzheimer's, mental dementia, and a lot of people, cognitive decline, old folks disease, that kind of thing. Always in passing. Oh, you're just getting old. You got Alzheimer's, don't you? Okay, maybe. So November is also National Alzheimer's Awareness Month, spotlighting the rapid growing number of older adults affected by cognitive decline. In other words, and this is not true for everyone. I'm 70, and I think I have a very sharp mind. I love practicing this. I think that one of the things it says about Alzheimer's, if you lose your ability to study, read, educate, grow, lifelong learn, then, like anything else, things get rusty. That's what retirement was for a lot of people that I do when I saw people retiring. They retire, and within a couple of months, particularly African American men, they die. And we're seeing it in the women too. But the offshoot, if you don't die, is cognitive decline. Just think about it. Getting up every day, going to work, functioning, having to be do a job and be the person that they go to, or to find out what's happening. And so when you lose that, when that drops to nothing, then what are you doing? People need to plan to retire. They need to plan to stop working. And what's going to be your next phase of your life? What's going to be the next chapter? I'm going to practice medicine as long as I can. I love it. I love the mental exercise. I love the research. I love learning new things. I've learned about several electronic medical record electronic medical record systems since 2009. The most memorable one is NextGen. From NextGen to what now is Epic. And you have to. There's a youth movement in medicine that is unfortunate because sometimes when you move to that youth movement, you use the skills of those older workers that have seen things and learned things and understood things, and then there's a deficit. In other words, how could a 30-year-old tell a 60-year-old about how to live their life? The 30-year-old wants to get married. The 60-year-old been married for 20 years. Who could tell more about marriage or relationships or functioning? The 30-year-old or the 60-year-old? Maybe the 30-year-old could, but definitely the 60-year-old should be able to. And so cognitive decline, what is that? Slowing the mentation, forgetting things. It ain't just losing your keys. It's not just forgetting. Yeah, it is forgetting to put socks on. How about that? It is the loss of the normal processes for functioning. In other words, I've had college professors that could recite to me their best talks on English, literature, mathematics, but couldn't remember what they had for breakfast or would need to be fed their breakfast. And a disease like Alzheimer's affects the entire family. All these processes affect the whole entire family. There's nothing here that I'm talking about that doesn't affect the family. Lung cancer, for me, the loss of a father and him suffering. And me, with all my medical skills, could do nothing because it was too far gone. It had metastasized. The cancer metastasized to his brain. It was the size of literally of a grapefruit. When they removed the mass from his brain, it decompressed his brain because he had been forgetting a lot. So, is it Alzheimer or was it a lung tumor in his brain? Could have been a little bit of both. So, attention focuses on early cognitive screening, which is, they have a cognitive screening exam and the EPIC for, be able to do to repeat a watch, draw a watch and then have the person draw the watch, have them recite world, WOL, have recited backwards, the words back, DL, ROLW, so you go back and forth with it, so world, spell world backwards, or numbers, 1, 2, 3, 4, 5, 5, 4, 3, 6, simple stuff. Have them point out objects in the room, have them remember it, basic screening, but you'd be surprised how many people fail it, and not because they can't do it, it's because English barriers. English is a second language. Just not attentive, it doesn't interest them. You have to do something probably these tests have to be culturally kind of based because they're mostly based on white male answers. Now, medicine for a long time was based on white males treatment, the pharmacology. Freud gave us our mental health issues. Oedipus complex. Kill your father, marry your mother. Okay. Which don't relate to us. So what we're seeing now is since it doesn't relate to us, then it must not be that important. Culture is not important if it doesn't relate to me and my kind. And that's where we lose a lot. That's why we don't have people entertaining our system, because they don't trust it. And it minimizes them. And it minimizes their family structure and the interactions of their family and their partner. And their ability to say, this is moving a little fast for me. I want to take a time to kind of like talk with my family and think about this. You're not giving those avenues. This is Believe Radio, 24-hour inspiration on gospel music. I'm George Pearson. I'm a PA. Thanks for listening. I was looking at some stuff, and I just kind of want to always thank the community for their support and all the things that they do. This article, he said, the Department of Education says nursing is no longer a professional degree. See how it affects student loans. That's about the money, right? Saying PAs aren't a professional degree. Huh. Then what are we then? I did a lot of education, a lot of study. Took a lot of testing, continue to test. Oh, that's so I can't borrow money for my education. Really? Is that why this is? Huh. Well, interestingly enough, I think that we have to understand that we are in a society of minimization. We're in a society of limitation. We're in a society that does not hold each individual as important and valued. You know, it is we have a transactional president. I didn't really not understand. We have a transactional president. We don't have a president for and by the people and to the people upholding. We have a transactional president. And I think that we have to we have to understand what that means. That everything's for sale. The White House is for sale. It's always been for sale. This is just a president that's come out and said it's for sale. And so I think that we have to be kind of on our guard, on our mind as a group of people that is aware that this is happening. Number 4 is men's health. And November is men's health for a discussion around, in men's case, lung cancer, prostate cancer, testicular cancer. Its initially highlights the suicide rates among men, particularly older men, older white men, underdiagnosed, depression, cultural stigma. And I think that's what this whole thing is about. Men want to reclaim their right at the head of the table. They want to bang their spears and beat their drums and say how great they are as men, how wonderful it is to be a man. And in reality, quit using the word alpha as a designation for the hyper macho male. That's not alpha. It was never defined as that. If alpha was defined by a psychologist in the late 40s who did a study of wolves. I think the 40s and 50s on a study of wolves. And what he thought he initially saw was a larger wolf and other wolves following him, right? Pack mentality, right? The head of the biggest, baddest leading everybody else. Well, made a lot of money, got a lot of people, did alpha societies and all this thing, the alpha male, and ends up, he redid the study, redid the group of wolves, and realized that it wasn't a pack. It was a pack, but it was a family. It was the father wolf with the mother wolf and the children. So the real alpha male is a family man. I thought that was so funny when I first heard it. The real alpha man is the family man. So that means my father and my stepfather, they were the real alpha men. They were the real alpha men. They took on families and they took on children. They took on children that weren't theirs. So That's interesting. So for all you alpha men out there, y'all go and make sure the family is good and the mother of your babies is good and the babies that you brought into the world are good, because that's a real alpha male. I don't know what the other one is defined as. Hey, so again, with the cancers, it promotes routine screening for prostate cancer, especially for African American men and who has a family history. Why is that? Because we tend to have prostate cancer earlier, and it tends to be more indolent, and it tends to kill us quicker because we don't get in for care, because we're afraid of a healthcare system that minimizes us and dehumanizes us. And so who wants to do that? It's like being told you're not enough. You're never enough. You're never good enough. It's never enough. So you get tired of hearing that. So for men, hey, get screened, get into the doctor, get evaluated, get seen. That's what Coach Prime was saying. Hey, get evaluated, get seen. You know, have that conversation. You know, come in with a plan. Look, go to GB Chat. Say, what's the top 10 things that kill black men in America? I want to get screened for that. Oh, it's behavioral health change. I got to stop smoking, stop drinking. Yeah, that's part of that health paradigm. Proactive, preventive, as opposed to waiting for something to happen. Number 5 is flu and respiratory illness prevention. Now, why is that important? Because there's been such a demonization of vaccine, been a demonization of the use of vaccines. This HSS Secretary Kenny is talking about on the website, vaccine causing autism. No, it may make you think you're dumb for even thinking it, but no, vaccines do not cause autism. One of the reasons I didn't do pediatrics, because I saw this coming. I didn't want to fight with parents about vaccinating their kids. Because when the kids got sick, they would come back to me and say, why is my baby sick? I said, well, you didn't get him vaccinated. Well, you need to fix him. Okay. Speaking of our commander-in-chief, Chief, he was anti-vaccine and brought in a person that was anti-vaccine. But when he caught COVID, guess what he took? He took all the medicines that they had. The whole family was sick, part of it too. That's the discussion you have to have. And as a man of color, I just didn't want to have a conversation with folks that weren't hearing it. And I'm thinking that, boy, you want to. Now, I grew up in vaccine. I'm a vaccine kid. That's why I believe in them. Polio, you had they gave it to you in a cup of a sugar cube, but they gave it to you. They came into the school and gave it to you. Up until a certain point, they gave you flu vaccines. And now it's this animosity around prevention, because that's what all vaccines are. Vaccines are prevention. So November marks the part peak respiratory illness in the U.S., including influenza, RSV, respiratory sentinel virus, and other viral infections. Public Health Agency emphasized vaccinations, hand hygiene, mask use when appropriate, and protecting high-risk groups such as children, older adults, with chronic conditions. This month highlights the importance of reducing hospitalizations through prevention and early treatment, especially in communities with limited health care access. So what we see is a shrinking access, a shrinking providers to a sicker population. A sicker population. and the use of definitions to define professions. So I think that we have to be about understanding that this is ongoing attack, ongoing issues, um, and diabetes remains a continued health concern. And the impact of African Americans, Latino, and Asian communities due to genetic predisposition, dietary patterns, and structural barriers to care. Now, if I had read this 10 years ago, it would have just been dietary patterns, and um, they would have called it compliance. They would have called it uh, we just don't want to take care of ourselves, basically. You know, they would blame the person for the problem, like in obesity, blaming the person for the problem, not the fact it's a medical condition. It's been well proven scientifically that the people that develop these BMIs over 25 and go on to have 30 and 40s aren't just trying to do it. Interesting enough, in terms of body mass index, the Asian community should be rated at 23, not 25, because of their body mass. So you even have to get into the weeds in terms of culture, because a lot of folks that when we had BMI of 25 for the Asian community, we're missing a lot of diabetes, a lot of pre-diabetes, because we thought it was a model minority, and in reality, it wasn't. Again, the focus is on screening. Get your A1C, which is a blood test that looks at red blood cells over a 120-day period and sees the level of sugar in them. And again, the A1C is normal is less than 5.7. Anything over 5.7 going to over 5.7, 6 to 7 puts you in diabetes, pre-diabetes, diabetes range. And that's when you have real thirsty or hungry, urinating, weight loss, blurred vision, skin infections, but that's well into the disease. And at that time, probably people need to be on insulin also, because they're having catabolic symptoms that break their body down. And again, early detection, early prevention. That's the key to all of this. You have to. And early detection of prediabetes and culturally tailored prevention strategies for women, particularly those with a history of gestational diabetes. That means diabetes during pregnancy. How significant is that? So it's significant in the idea that if women are pregnant and having diabetes in their late 50s, in their late 40s, 50s, 60s, they start developing diabetes. So it's an ongoing piece. Blood pressure the same way. That's why these women have to be monitored, because they're more at risk for heart attack and stroke, for cardiovascular events. Having a child is not easy. Having a child is one of the most dynamic processes a woman will incur. So when a woman has to carry a child, she should carry the child because she wants to, not because she has to, not because she's forced to. That creates a whole bunch of toxins going to the fetus, cortisone, all the bad stuff. Because the woman is fearful for her future and the future of her child. And maybe she wanted it, maybe she didn't want it, but it's there now. So it's interesting that this administration will not allow you to terminate a pregnancy, but will not help you once that child is here. terms of social services, in terms of aid, in terms of WIC, in terms of SNAP. Just think about the number of women had kids that their SNAP benefits were taken. Over what? Nothing. Over not the ability to have a bipartisan agreement. My way or the highway. That's what Marjorie Greene just found out. So key populations that we concern ourselves with: African American, high rates of complications, kidney disease for diabetes and amputations. Latino, high national prevalence of type 2 diabetes. Asian is a monolithic. Asian is Indian, Chinese, Pakistani. It's South Asian. So when you say Asian, you're talking like you say black. It is a kaleidoscope. You say Latino, kaleidoscope. And so Asian, higher risk at lower BMI thresholds. Again, we talked about that. 23, it should be the standard for Asian folk. In order to pick up diabetes. See, thin on the outside, fat inside phenotype. Women increase risk with gestational rate and menopause-related metabolic changes. Again, concern issue. Lung cancer and smoking-related diseases. Again, we need to be equitable screening via low-dose CT scan for adults at risk. African American men face the highest mortality rates due to later diagnosis and related systemic barriers. Asian populations show unique risk patterns, including non-smoking related lung cancer. Latino smokers often have lower cessation support and later engagement with screening. Women's lung cancer rates are rising due to vaping and environmental exposures. Public health messaging now emphasizes both smoking cessation and non-tobacco environment risk factors such as indoor pollutants and workplace toxins. Now your workplace, now your environment, it puts you at risk for lung cancer, just not smoking. Key monitoring population: African Americans, highest lung cancer death rates despite similar or lower smoking rates. Asian, high prevalence of non-smoking related lung cancer. Latino, lower screening access and cultural stigma, and stigma for all of it. And cancer diagnosis, women risking women rising incidence of higher impact from indoor pollutants, as well as access to smoking, as well as income that allow them to smoke and drink. That's what I've seen as a difference. It's more women of color ordering dark alcohol. It's more women of color smoking because they go to the vacations, they do the hanging out and all that kind of stuff. Men of color just trying to keep working. Again, access. Again, disparities. Again, that's what the issue is. And I think that we have to be okay with understanding these are issues and then addressing them. And that's just the big five. Again, we talked about diabetes. We talked about Alzheimer's. We talked, again, these are concerns that make us have to go, what's going on here? And how can we best address these things comprehensively? We have to be proactive as opposed to reactive. We have to advocate. Because what's going on now is we are being submerged in mediocrity, mediocre care, mediocre answers, mediocre, mediocre. You have to ask yourself, Why did, in the initial onset of this Epstein Files issue, that no Republicans voted for it, and if not for a turnover in a seat, they still wouldn't have voted for it. But when that 2218 vote came in as a discharge petition, which means we're requesting information be provided from us from a branch of government because we are the legislators here. When that happened, you had to ask yourself, well, gee, if this is about discussions of women and women that have been sexually abused and traumatized, you now have to be forced to make a vote. Which side are you going to be on? And wouldn't you know, 427 members, 218 members decided, and then another 217 decided that we're going to go with this discharge position to get the Epstein files. And here's the I got you. I'll say it again. President Trump could release the files today. He could direct the DOJ not through legislative order, but his own hand say, release the files. I want them all released. So now there's a 30-day cap on it. And the question is, will those be the files that were before the approval or after approval? Because they've had access to it for a long time. And some say maybe 1,000 sightings of him in these documents. And that's just the beginning. It's more information. It's information that they don't want to come out. Well, now they want to be transparent because they were forced to. So whenever you're forced to tell the truth, you try to dip it in your way, right? I think that we have a lot to learn, a lot to be thankful for. And I think that this is going to play itself out. It's going to play itself out in ways that I think, like I always said, it's not going to be what they want it to be. It's not going to be that. It's going to be something totally different, and they're going to have to deal with it. And I think that it's I think that once this comes out the way it's going to come out, a lot of people are going to be surprised. A lot of people are going to have egg on their face, and they're not going to be happy about this because it shouldn't have been that. It should not have been what it came down to. This should have been information they were willing to provide because they wanted the truth. But they didn't want the truth. That's why it took so long. You know, history has a way of playing itself out. And you always wonder why things happen the way they happen, because they were supposed to happen that way. You know? And I think that we have to be the vanguards of our freedom and of our culture, you know, who we are. And if we're not, you can certainly see that they're not going to do it. They don't have any benefit to doing it. And I think that that's going to be our core function, is to keep people honest. As the saying goes. This is Believe Radio, 24-hour inspirational and gospel music station. My name is George Pierce. I'm a PA. Physician assistant / associate. Now they have new titles for us, right? And want to be clear that definitions don't make a clinician. The clinician makes the clinician. And I've been blessed to serve folks for 43 years. And so whatever limits you want, you just need to put them on yourself. because that's what it is. Um, I want to thank you folks for following Education is the Best Medicine. I want to thank you folks for uh, giving time and all the things that make this what it is. Appreciate you all. I've learned a lot. I continue to learn. I continue to grow. I continue to be a lifelong learner. I continue to want to understand everybody's point of view and make it inclusive. And I think that that's my job as a clinician, to hear everyone and try to be inclusive to their needs and concerns and issues. Um, I want to thank Adamology for coming down and opening up the station today. I want to thank Curtis for being who he is. Love you a lot, Curtis. And Miss Howard will be back next week. She's on VKK with family. It's always good. Always good to hang out with family. And I want to thank you guys for lending some time and giving me some time with you, all of you. I really am blessed. Been very powerful. We continue to grow, continue to change, and we're gonna be doing some different things because education is the best medicine, is a lifelong thing for me. And I, as they say, I gotta keep it moving. Gotta keep it moving. And want to thank you all. And it's challenging. It's challenging to grow. It's challenging to be. Uh, uh, I'm grateful for my son. He's taken the mantle of fatherhood and is pushing it. It's good to see that. I think it's changing him in a way that I don't think he imagined. Like he changed me. So we'll see how it plays out. I believe it's a good thing. Want to say thank you to everyone. Dr. Green and Dr. Lenore and Dr. Tunde, pediatrician over on the East Coast. Love him lots. And all the folks that I've been able to bring into this tent on the journey. We have to be okay with being okay. And I think that's one of the things that I'm excited about. And the areas of for example, quality measures, quality care measures, and it's usually should be an intensive multi component part of any practice. The most effective first line therapies, example for weight loss, are reducing the BMI, culturally tailored interventions showing additional benefit in the Asian community, also population through long term outcomes being modest and variable. Again, this issue around the BMI being reset for Asian folk, and Asian is a tent. Again, I said you have Indian, Chinese, Pakistani. It is again. It is a globe. We have to get out of putting people in boxes. We have to be okay with differences. We have to be okay with growth. Example, statin therapy for cardiovascular prevention. Statins are effective for primary prevention of atherosclerotic disease, reducing the risk of heart attack and stroke, and all-cause mortality in adults, and increased cardiovascular risk. So that's why we use statins now. Those are the orthostatins, Lipitors. These drugs decrease inflammation, stabilize plaque formation, and prevent people from having heart attack and stroke. Over 65, majority of heart attacks and strokes are silent events. Believe this is one of the causes: inflammation and fatty emboli. The U.S. Preventive Task Force, the American College of Cardiology, American Heart Association recommends statins for adults aged 40 to 75 with greater than one cardiovascular risk factor. What? Obesity. What? Diabetes. What? Hypertension. What? Cognitive decline. And also they score a 10% risk. If it's greater than 7.5, you want to have people on statins. Impact of adherence in communities of color. Statin adherence is lower among Black, Hispanic, and other ethnic minority groups compared to white adults, contributing to persistent disparity in atherosclerotic cardiovascular disease. Socioeconomic deprivation, lack of health insurance, and limited access to care are key drivers in suboptimal adherence and under prescribing. Because people don't take the medicines. They don't want the medicine. They say the medicines don't work. They make them sick. But when they have a heart attack or stroke, what's the issue? It's prevention. Major risk differentials related to statin use. Atherosclerotic cardiovascular disease risk is higher in Black and South Asian populations, and risk calculators reflect this view. So, people of color, Asian communities of color, particularly South Asians, have more risk. Statin benefit is proportional to baseline atherosclerotic disease risk. Higher risk individuals derive greater absolute benefit. So if you're obese, if you have diabetes, if you have hypertension, then you need to be on these drugs to limit your risk of heart attack and stroke. And what they're understanding now with this on a microscopic level, that the blood clots either by sugar or fat. And that clotting travels throughout the vasculature. And as you get older, it does it more and more and more. And this is not something to stem the tide like diet, exercise, plant-based foods, decrease alcohol smoking. Then you are putting yourself at risk for a heart attack, stroke, or cancer, or worse. Says statin benefit is, again, more risk you have, the more you should be on. Social determinants like insurance, income, structural racism further widen the risk and treatment gaps. Some ethnic groups, East Asians, may have increased sensitivity to statin doses, especially with rosuvastatin. So everybody can't take everything. And that's why I think it's an exciting time now, because we're lining up the cultural data to provide people their best chance of being successful on these treatments. Because many years ago, they were just tailored for white men. That was the model. That's who's tested for these medicines. They just started testing women. That's the issue. This is Believe Radio, 24-hour gospel inspirational station. I'm George Pearson. I'm a PA/associate. I want to thank you for your time. And in these times, understand that, it's only as bad as you make it. It's only as hard as you make it. We'll survive this. We always have. Hard times don't last, but hard people do. And so in the time when it's always, you think it's your worst, it's probably your best. You just didn't know it. My mom said God was always delivering her from something that could have been worse. I want to thank you guys for coming. We'll see you in December.